Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Lichen planus, and we are looking at its nail changes. So the nail involvement in lichen planus, it occurs in about 10% of the cases. So it is present in 10% of the cases and usually minor feature of the disease. So there is a dorsal nail pterygium. So dorsal nail pterygium. So this is the most specific nail change in the lichen planus. So it is most specific. There's a fusion of the nail fold and the nail bed. It leads to the pterygium. So how is the pterygium formed? There's a fusion of the nail fold and the nail bed. So the fusion of the nail fold and the nail bed, it leads to the pterygium. Next, moving on, what will be the most frequent nail change? So when you look at the most frequent nail change is the exaggerating the longitudinal lines. So this presence of exaggerating longitudinal lines and also the linear depressions. So there's also the longitudinal lines, there's linear depression, and this is due to the slight thinning of the nail plate. There will be thinning of the NP, that is a nail plate. So there are some significant names. There is a pump tent sign, presence of the pump tent sign, and this is the elevation in the nail in the shape of the tent. So they have a tent shape as the name suggests. Then there is something known as a trachyonychia. So there is trachyonychia. So trachyonychia, it is 20 nail dystrophy. It is the 20 nail dystrophy. Then comes the subungual hyperkeratosis. So there is the subungual hyperkeratosis. So this is, and along with the onycholysis. Then comes the longitudinal melanochia, melanochia, and this is in the lichen planus of the nail bed. This is in the lichen planus of the nail bed. Next we look at the permanent destruction. So there is the permanent destruction. So this destruction, it is of several toenails. So this is of the toenails, and there is also ulceration of the soles. So there's ulceration, and this is present of the soles. To learn and grow daily like this, please do subscribe.